Come here. Come here. Do you really want to be a nurse?
Nursing today is in dire straits. It is one of the most high risk careers in the United States. Listen to some of this information. It's ranked one of the top 5 jobs that people are leaving in the United States today. It's one of the top 10 most dangerous jobs according to multiple news and science surveys. 40% of nurses have high risk of long-term sick leave. And that's according to the Journal of Occupational Medicine. The average nurse over 35 years old is on 5 medications. They cite limited time off, swing shifts, understaffing, patient volumes, and high stress in the workplace. You can't make women work 12 hours and not be allowed adequate amounts of time to eat and drink water throughout the day. It leads to metabolism adaptations that slows their metabolism down, builds oxidative stress, causes reactive hyperglycemia. Now they're stressed, now they're tired, now they're using caffeine all the time. Nearly 40 to 55% of nurses, depending on what study you read, are overweight, and it is not from overeating. These women are underfed, overstressed, and they are some of the sickest in our community, and they are the people who are responsible for taking care of us. How in the hell can we count on a medical healthcare system that can't even take care of its own people and expect it to take care of us?
What's going on? Nurses are leaving the profession. They deal with a lot. Many complain of being overworked, underpaid, underappreciated. And I understand. How do I understand? Well, because I've been an RN for almost 8 years and I know the struggle and I can really relate to a lot of things that we're going to see today. A lot, especially when it comes to the um, coworkers and the bullying. And it's funny how people think that nursing is all about glitz and glamour, especially since social media is so big now. They don't understand. These youngins don't understand that it's a lot of work, especially if you're med surge. It's no matter where you are, it's a lot of work. Um, and many times, a lot of times, that your hard work goes unappreciated.
Nurses, why all of y'all quitting?
They're quitting because they got on this app following all of the nursing influencers who can only promote the aesthetic side of nursing. And I mean, rightfully so, because you can't by law show the nitty gritty of actually working in nursing. So once they finally finished nursing school and actually got in the field, they found out that nursing was more than bog bags and Stanley Cups. They also found out that when you do travel nursing, you need to have 1 to 2 years of experience before you could go ahead and do travel nursing. And even when you get that experience, that 10K don't come easy. We actually have to work for that money, and I do mean work. I mean, and don't get me wrong, nursing is a well-paying job, but it's one of those jobs that you actually have to enjoy or have some type of passion for, like, or you just enjoy helping people because it's a selfless career.
She ain't never lied. It's some work, a lot of work involved in that. And people do think it's all about shining, showing your butt off and thighs, but it's a lot of dirty work, a lot of hard work.
Does anyone know what they're doing? I graduated nursing school in March and I don't want to be a nurse. I had a full ride through a hospital and I was supposed to work there for 3 years, and if I don't work there I have to pay all my college back. But I don't want to work there or be a nurse. But I don't know what I want to do. I have like this crazy urge that I'm young, I'm like independent, like alone, and I can do whatever I want. And so I know for the next however many years, I don't want to just go to work every day. Like I want to do something bigger. But I have like no idea, and I have to pay back like all this money. I think I literally have to make this decision in 3 days. And I've had it in my mind that like I'm paying it back, I'm not being a nurse, but now like the numbers are hitting me and I don't know what I'm doing with my life. Like I thought after college it would be like the best life ever. And I literally just have no idea what I'm doing. Like each day I'm like, what? I don't know what to do. I'm alone. Like I feel lonely sometimes, even though like sometimes I feel super independent and I'm like happy. I'm like proud of myself, but this makes no sense. This video is like trash, but am I alone or does anyone else feel this way?
Honestly, I think it's more of not so much of a nursing issue with her. I think it's kind of just young. You got to suck it up. Life is like that. People don't care about you. You got to work hard. You can't just do big things automatically. And sometimes I think that affects people's brains, like what they see on social media. They think that they see people doing it big time, what appear to be doing it big time, but so they automatically think that, hey, I'm 22, I'm way behind in life. I should be doing more.
I hate being a nurse. Ever since COVID, the way we get treated is inhumane. The abuse, the racism, the bullying, and before you come saying that's what you signed up for, it wasn't in my oath when I took it 19 years ago. Saturday morning at about 2 a.m., I was spit on by a patient. He was aiming for my face, but he ended up getting me from the neck down because I quickly turned my head. And before y'all come assuming, no patients are ever abused or mistreated in my care or around me. And often being the only Black nurse on duty or one of two is very hard. And y'all love asking what color has to do with it. But Black people in healthcare are still viewed as slaves. So when I went to the charge nurse to de-escalate the situation, she laughed. She said, oh, well, he's dying anyway. And yes, I was the only Black nurse on the unit and in the entire facility on that shift. He didn't spit on me because he was dying. He spit on me because he viewed me as trash. And yes, I'm in the process of transitioning out from nursing, so you don't even have to suggest.
Real talk, I kind of feel for that lady. It's tough. And I worked psych, so I understand being spit at and swung at, a bunch of other things. I don't necessarily agree with the being a Black nurse viewed as trash. You cannot go around life and live life thinking that people see you that way, because that negative thinking can weigh on yourself, and it can low key affect how you view yourself. Um, I noticed when I like matured and got older, when I matured and got older, and I changed my way of thinking, less like a victim. Well, not like a victim. I let go of the victim mentality, all the racial stuff, and carrying what people think about Black people, or oh, I'm dark skinned, they really hard on me out here. When I let that bullshit go, I started to prosper. Well, before I prospered, my eyes opened and I saw the world differently, and more opportunities came my way, and life just got so good. Also, I want to point out one thing, that patients are sick. That's why they're there. Whether it's mental or physical, they're not at their best. So we can't take it personal, like things they say, things they do, because it's not, in most cases, that's not their norm or how they would be acting if they weren't sick.
Being a nurse, and I'm going to tell you why. For some context, my name is Cindy. I've been a nurse for about 5 years. I became a nurse in 2020, and I quit this year, and I actually work from home now as data analyst, and I'm going to tell you the exact reasons why I quit and why I'm so much happier now in my new career. The number one reason that I quit is because I hate working with other nurses. I'm not saying all nurses are bad. I just have had my fair share of nurses who were just straight up bullies, made my job miserable, and they were just miserable themselves and just brought the vibe down at work, and it was just such a negative environment to be in. Second biggest reason is because of management. When I tell you, I have not had a single decent manager in nursing. These people gaslight you. They don't care about you. They just care about their bonuses and their paycheck. They don't care that you're struggling on the floor. They don't really genuinely care about the patients either. And when your manager doesn't care about a patient, it kind of makes it hard for you to care about your job as well. The third reason is controversial, but I'm going to say it anyway. I hated working 312s. Everyone's like, I have 4 days off. Okay, but now I work 5 days a week, and I feel like I have more time and more mental space for myself and my friends and my family. When you work those 312s, those 4 days off, you're laying in bed for 2 recovering. You're thinking about coming to work for the next few days, and you have to meal prep, you have to prepare, you have to rest. It makes you not want to do anything because you don't want to be tired and like strain yourself before you go to work. I decided enough was enough. I went back to school, got a certification in data analytics, and now I do work in the healthcare sector doing data analytics, and I couldn't be happier. I have amazing managers. My hours are wonderful. I set my own schedule. I work from home. All around, I 100% do not regret leaving nursing.
Well, there you have it. I would like to hear from nurses or soon to be nurses. Do you like your job? What kind of recommendations could you provide for youngsters who just getting started out in nursing or consider nursing? Are you experiencing the same things these people are experiencing? So I'd like to hear from folks. So anyway, enjoy your days. Peace.